I'm Dr. Sanjeev Das from Nepal, and I'm a general surgeon. I have planned to prepare for MCS entrance preparation and tried my best to get some information from several social sites, but I couldn't make it because studying course of MCS entrance preparation in Nepal is quite expensive, and it's not very easy for doctors to leave from their jobs and go to have a course. So I try my best to upload a video which will be useful for learners like we all guys. Okay, and I hope that these ideas will concise almost a lot of knowledge that we are going to need for specialization registration and MCS entrance preparation. So without wasting time, let's jump into it. Okay. So first note that I have made, and I'm going to learn. I'm going to read this one as well as we are going to enjoy the slide, the note, slowly as well. Drug of choice for urinary colic is diclofenac, Vivarin. Most common type of kidney stone is calcium oxalate. Struvite stones are infectious stones. Staghorn calculi, PC and L. ESWL is TOC. Most common bladder calculi is uric acid, sterile urine, infected urine, struvite stones. Schistosomiasis drug of choice is praziquantel, metronidate, or oxaminoquine. Malignant cystitis, MVAC, methotrexate, vincristine plus adriamycin plus cisplatin, LCT. Leydig cell tumors, 25% occur in childhood, bilateral in 5 to 10%. Ring kiss crystals are fusiform cytoplasmic inclusions are pathognomonic for Leydig cell. Lab findings for LCT is increased serum, urinary 17 ketosteroids, and estrogens. Radical orchidectomy, RP, L, and D. Okay, so we are going to jump to next paper. Okay. Revised Glasgow Coma scale. We have learned in NMC preparation as well, but this one is a very important part. That's why I have made this one in note as well. In this one, specialization registration and MCH entrance preparation as well. Eye opening, verbal response, motor, M. Okay. So STTN is for eye opening, for verbal responses, OCWSN, and for motor is OLNAEN. Spontaneous for to speak, 3 to press, 2, none, 1. Verbal response oriented 5, confused 4, words 3, sounds 2, none 1. Motor, obeying commands 6, localizing 5, normal flexion, withdrawal 4, abnormal flexion 3, extension 2, none 1. Drug of choice in shock. Anaphylactic shock, adrenaline, cardiogenic, non-adrenaline or dopamine, distributive, NA, phenyl, epinephrine, hypovolemic, crystalloids, shock plus oliguria, dopamine, hypoadrenal, corticosteroid, septic shock, broad spectrum, antibiotics. Okay, next one. Oh, only two slides. Only 2 slides or 2 papers in this book. And there are my students. They are preparing for MBBS entrance. They are medical aspirants, so they are learning from me, and they are trying their best to get a scholarship. Let's see what happens. They are really good learners. Okay, next slide is third one. Even I haven't seen the correct phonetics of this word, so maybe I will make some mistake in pronunciation. So I hope all you guys please forgive my bad pronunciation. If I pronounce some word mistaken, and if I make any blunder, please try your best to forgive me, and hope you can comment with a good pronunciation and good ideas in the comment box. Thank you very much. Okay, so carry on. Gibbons hernia with hydrocele, Burgers hernia into pause of Douglas. Becklar's hernia, femoral hernia through opening of saphenous vein. Emmons hernia is inguinal hernia containing appendix. Ozil's hernia is hernia through defect in conjoint tendon just around to where it inserts with the rectus sheath. Stammer's hernia, internal hernia occurring through the window in the transverse mesocolon after retrocolic gastrojejunostomy. Peterson's hernia is hernia under Rock's limb after Rock's NY gastric bypass. Valpau hernia in front of femoral vessels. Holfau's hernia is inguinal hernia with extension of the loop of intestine along inguinal ligament. Another note. Stomach carcinoma. TIS carcinoma in situ. T1A. Tumor invades lamina propria or muscularis mucosa. T1B. Tumor invades mucosa. T2. Tumor invades muscularis propria. T3. Tumor invades subserosal connective tissue. T4A. Tumor invades serosa, visceral peritoneum. T4B is tumor that invades adjacent structures. And 1. Meta in 1 2 lymph nodes, and 2 meta in 3 to 6 lymph nodes, and 3A meta in 7 to 15 lymph nodes, and 3B meta in 16 or more lymph nodes. M1 distant metastasis. Stage dropping. Stage 1A to 3C. 1A T1 and not 1B T1 and 1 T2 and not 2A T1 and 2 T2 and 1 T3 and not 2B T1 and 3A T2 and 2 T3 and 1 T4A and not 3A T2 and 3A T3 and 2 T4A and 1 to 2 T4B and not, as I guess, because I can't see it very clearly what's written. Okay, let's go to 3B. We have to continue to 3C and then finally 4, which is for palliative surgery. Okay, 3B is T1 to 2 and 3B, T3 to 4A and 3A, T4B and 1 to 2. 3C is T3, 4A and 3B, T4B and 3A and 3B for any T, any N, any T, any N or M. Let's go to next now. Really complicated to understand, right? We need more and more revision to master it. Classic painted. Kidney stones, painful bones, abdominal groans, psychic moans, fatigue, overtones. Parathyroid carcinoma is suspected preoperative by significantly elevated PTH, presence of severe symptoms, several serum calcium level is more than 14 mg per deciliter. Let me see. Even I haven't mastered it very well. Pheochromocytoma is headache plus diaphoresis plus palpitation. Malignant pheochromocytoma is P53 BCL2 activated telomere, and bone is more than liver, is more than lymph nodes. Neuroblastoma, most common site is adrenal, 30% paravertebral, retroperitoneum 28%, postmediastinum 15% is more than, pelvis 5% is more than, cervical area. Signs of pulmonary hydatidosis: meniscus sign, double auroch sign, moon sign, water lily sign, crescent sign. Garvey classification: hydatidosis type 1, pure or clear fluid collection; type 2, fluid collection with a split wall; type 3, fluid collection with septa; type 4, heterogeneous complex mass; type 5, calcified mass, egg cell. CCBs are daltism and nifedipine. Best natural vascular graft is REV. Oh, I don't know the full form. I have to look at it again. REV is saphenous vein. Best synthetic vascular graft is Dacron. And best vascular graft for infrainguinal bypasses, saphenous vein aorta, Dacron. Most preferred graft for CABs is Lima, left internal artery. Yes. Left internal mammary artery is more than saphenous vein. Most commonly used graft for CABs is saphenous vein. Most common genetic cause of thrombophilia is factor V, factor 5, latent blood coagulation disorder. Most common blood coagulation disorder, as according to my note, is factor 5, latent. Varicose triad, endothelial injury, vascular injury, hypercoagulability, thrombophilia, stasis, gold standard treatment. Varicose vein is endothermal ablation. Inverted champagne boat leg is seen in varicose vein. 1, 2, 3, and 2, 5, and 6. We are going to practice in the first video will be about 10, okay, no more than that, and I have made about 100 or a little more than that. And yeah, obviously reading it as well, it takes a lot of time. Okay. Most common neoplasm of salivary gland is pleomorphic adenoma. Malignant tumor is mucoepidermoid carcinoma. Neoplasm tumor in children is hemangioma. Malignant tumor of children is mucoepidermoid carcinoma, minor salivary glands, adenocyst carcinoma. Adenoid cystic carcinoma, most common malignant tumor of minor salivary gland. Example of LASSL system of classification: bilateral complete cleft lip and palate is LASSL. Left complete cleft lip is L. Right incomplete cleft lip and alveolus 1A incomplete hard palate and complete soft palate defect SS. D of suture removal by areas: eyelid 3 to 4 days, eyebrow nose 3 to 5 days, lip face 3 to 4 days, scalp 6 to 8 days, chest abdomen 8 to 10 days, ear 10 to 14 days, back extremities 12 to 14 days, hand 10 to 14 days, foot and shoulder about 12 to 12 to 14 days. Rules obtained in cleft lip surgery: Williamson or Musgram. Age more than or equals to 10 weeks. Weight more than or equals to 10 pounds, and hemoglobin should be more or equals to 10 gram. Okay, this is the rule of 10 in cleft lip surgery. Okay, now we are going to go for indirect hernia. Age. Indirect hernia at any age. Direct hernia commonly in elders and inguinal canal. Direct hernia. Next one. Herniation is protrusion through deep ring, and hernia for direct herniation through posterior wall of inguinal canal. Shape. A piriform or oval in shape, globular and round in shape. Okay, so I'm not going to tell you indirect and direct. Maybe there are some blunders as well while I'm reading. There are some mix-ups, so please look at the note very well, and obviously there will be a very few blunders, so I hope my words or my audio is going to help you as well. Next one, descent to bottom of scrotum and rare descent neck. For indirect hernia is narrow, and for that one direct wide. Sac is lateral to inferior epigastric artery. Next one is medium or epigastric artery. Siemens test. Cuff impulse on index finger. Cuff impulse on middle finger. Invagination test tip of finger. Palm of finger. Ring occlusion test doesn't bulge in case of indirect hernia. Bulge medial finger and direct hernia. Covering from inside out, extraperitoneal tissue, internal spermatic fascia, chromosteric fascia, commonly unilateral, fascia transversalis, conjoint tendon, commonly bilateral. Obstruction, common, rare. Sac should be opened during surgery, not necessary unless obstruction is present. Next one. We are going to make this video no more than 20-25 minutes. We are going to try our best to finish another 3 notes, 1, 2, 3, as soon as possible. Types of hiatal hernia. Type 1, sliding hiatal hernia. Type 2, true paraesophageal hernia. Type 3, mixed esophageal hernia. Type 4, paraesophageal hernia. Continuous other intra-abdominal organs. Meconial test is positive in achalasia. Cystic test is positive in achalasia. Laparoscopic Heller's myotomy treatment for achalasia. Excellent of Heller's myotomy 2 cm above GE junction to 1 cm below over the stomach. Scleroderma onset in 3rd or 4th decade of life. TF is an abnormal communication fistula between the esophagus and trachea. TF type C, atresia with distal TF 85% most common. Esophagus, lower smooth muscle, upper cervical region stratified muscles, middle gradual transition from stratified to smooth. Let's go for antithyroid drug of choice. In Graves' disease, methimazole. Antithyroid drug of choice in case of pregnancy is carbimazole. Antithyroid drug in thyroid storm is propylthiouracil. Follicular carcinoma in thyroid in female with mean age 50. Genes implicated in FCT, P53, PTE, and RAS, PAX. Thyroid, most common site of meta vertebra is more than ribs, is more than pelvic bones, more than skull. Parafollicular C cells are derived from ultimobrachial berries and secrete calcitonin. Anaplastic carcinoma is most aggressive form of the thyroid. Thyroid, most common site of metastasis of lungs. Wait. Most common site of metastasis, lungs. Right, ablation currently is recommended for all patients with stage 3 and 4 disease, patients with say stage 1 disease with aggressive histologies, all patients with stage 2 disease less than 45 years of age, and all patients with stage 2 disease 45 year or older age. Next, let's go. Next one. 1 1 2 3 4 5 6 7 8 and 2. Okay, so my friends, 2 3 4 5 6 7 8, we have done 10 notes. Okay, 10 notes that I have made, and there are so many important points on every note paper. Okay, so I believe this is going to help us, and in next video we are going to continue from note number 11.